Hello, this is Dr. Torres from the Institute for Functional Health, and today I want to talk about diabetes. So I really want to talk about type 2 diabetes more importantly than the other type 1. First of all, I want to kind of go over the difference. Type 1 is going to be usually autoimmune, or it's going to be something that we're usually born with. Type 2 will be what we'll usually struggle with later on in life. So I kind of want to break down those two issues and really what causes diabetes. So I know down here in San Antonio, diabetes is a major epidemic, and we need to talk about the causes of that. So many people have a misconception that diabetes is a blood sugar problem, when really it's not. Diabetes is going to be a cellular problem. So what ends up happening is these small little receptors of our cells, keep in mind our body's made of trillions of cells, from skin cells to eye cells to hair cells to heart cells. All of our cells have receptors that need to be able to accept sugar. Okay, so the only way that sugar can get into the cell, which is where we need it to be, is going to be whenever the pancreas will produce a sufficient amount of insulin. Now, what ends up happening over time because of stresses or because of poor diet, lifestyle, and genetics, our cells will have a tendency to lose their receptorship to insulin, therefore not allowing sugar to get into the cell. So the bad thing about that is now sugar will stay in the bloodstream longer than it should. Now, previously we thought that diabetes was strictly an obesity and overweight or poor lifestyle choice, but we actually have a whole lot more individuals now with hypoglycemia or low blood sugar actually becoming diabetic as well. Okay, so you just need to understand that diabetes is a cellular problem, and so therefore the treatment or the support for diabetes needs to be at the cellular level. Now, there's a lot of things you can do naturally, such as, of course, yes, improving your eating choices, looking at fat intake, making sure that you are supporting your blood sugar if you are a hypoglycemic person. So there's a lot of things that you can do, especially for type 2 diabetes. So again, if you have any questions, please go and give our office a call at 210-468-1891, and we'll be happy to answer any questions that you have.